Did somebody have a question then? No? Okay. Lost my slide. So there we go. So what we do know now from injury rates, from physios and stuff like that, is we start to see injuries in girls that we didn't see in boys so much. And especially because now it's much more of a level playing field in the impact sports and things like rugby and football and stuff, girls and boys are playing now. But if we don't monitor this and try and increase strength in legs and potentially try and realign the femur out a little bit by doing exercises and coaching, then we can get injuries at the hip, we can get injuries at the knee, or potentially at the ankle. Paula Radcliffe famously changed her style of running so that she changed the angle of the femur so it straightened up a little bit. So it can be done, and at a young age, by strength and conditioning and exercising the right sort of way, it can help to develop this. So that's one of the roles that we would look at. The last bit I've got on my slides here is osteopenia. Osteopenia is the early onset phase of osteoporosis, which is brittle bone disease. Now, unfortunately, in the UK, we are getting cases of this, and it's tragic, really, that young girls are starting to show the signs of brittle bone disease very early on. And that's just really because of a lack of physical activity, the right sort of diet, and role models, really, in terms of, like, you know, wanting to be a certain sort of look and very thin. So as a coach, we just want to make sure that we're offering children a range of opportunities that gets them engaged in physical activity. It doesn't really matter what it is, but as long as there's some sort of impact and those sort of things, just to try and develop. But ultimately, it's probably a lot more important for girls to be doing strength training than it is boys, because boys have testosterone, whereas for girls, once they go past puberty, there's not so much from a hormonal point of view that's making girls stronger. So the emphasis should be on strength and conditioning, really, in those areas for girls. You'll probably cover this with Laura, but the way bones, I'm terrible at drawing. That's a bone, all right? Looks like a dog bone or something, doesn't it? But we've got the long part of the bone, which is called the diaphysis, and then the ends of bones are called the epiphysis. Okay. Now, the hard part of the bone, like the outer edge, which gives the bone its strength here, is called the periosteum. Okay. And it's the periosteum that gives strength to the bone. Now, the way that works, actually, I'll just add something else on. Here, at the ends of long bones, are our growth plates. Technical name is epiphyseal plates. So these remain cartilage, these areas, these epiphyseal plates, until bones have stopped growing. Now, when a child grows or goes through a growth spurt, what they do is they deposit calcium and things like that, and cartilage, and grow from that way. And then what happens is calcium ions are pumped into the area and harden up that bone to make it strong. But ultimately, these can be a bit of a weak area, these growth plates. They're not solid bone, which is why we have to be careful with children at a young age in terms of too much impact or too much repetition of the same thing. It can be a weakness. If we damage a growth plate, then it can affect growth going forward. Now, growth plates are all different. If we take the growth plate in our arm, ulnar and radius, we know that we get much more growth at the distal end at the wrist than we do at the proximal end at the elbow. So If we get a lot more growth at the wrist, if we've got kids who are doing things like gymnastics and stuff like that and going onto the wrists a lot, then that can actually be a vulnerability. If we look at the humerus in the upper arm, we get more growth at the proximal end than we do at the distal end. So at the shoulder, it's growing much more. And again, if we've got kids who are doing lots of throwing and batting and tennis and those sort of things, then that can become a vulnerability. The real problem becomes in the leg. It's at the proximal end of the tibia and it's at the distal end of the femur. So either side of the knee is where we get most bone growth. And that can make the knee quite vulnerable if kids are overdoing it in terms of those. So if we see a growth spurt, we need to ease off on training. We need to reduce impact and intensity and wait until the body's adapted and caught up. And we might have to go through periods of that. Okay. Ultimately, the way that bone growth works, and same for adults really, is that your bones are strong enough to deal with what we do. But if we overload a bone, and the bone senses this here, so we do some strength training, we've got some running or whatever it may be, if the bone senses it could do we improving, it just sends more calcium into the bone, which hardens up the periosteum and increases bone strength. But it's going to be that progressive, regular sort of format in terms of keeping bones healthy and strong. Okay. So just looking at growth spurts, just a little difference, tends to start between the ages of 10 to 12 for girls, whereas it's 12 to 14 for boys. Now, there are differences there. You might get some boys will get it earlier, some girls will get it earlier. But that's the main age range. So as a coach, that's what we should be looking at in terms of amending sessions, watching technique, adapting what we do. You might find that if you've got 10 to 12-year-old girls and boys together, because they go through this growth spurt, they may start to become faster, stronger than the same age boys. And we see that quite often. Boys will catch up later. And then with testosterone and those sort of things, they will start to develop physically a little bit stronger and those sort of things. But maybe by about the age of about 13, they'll start to slow down for girls. And then really it's just over to what they do in order to keep strong and developing. From a hormonal point of view, it's just ticking along. There's nothing major. Some growth-related injuries. So I talked about injuries to the growth plates. So if we damage the growth plates through impact or overtraining, it can mean that that growth plate will maybe grow too fast. It might reduce down. And so from a medical point of view, that has to be monitored. A condition called osteochondritis, because bones are not strong, we've got the potential that part of the bone can chip off and break. And what happens there is that the bone then gets trapped in the joint. So every time that they go through like a joint movement, it can cause referred pain. So again, it's just an overtraining thing and doing too much or an injury and making sure that we coach right. But if that happens, that'll be a medical referral. We don't tend to associate back pain with children, but they can. If they overload the spine, if they're doing too much carrying, if they've got poor technique, poor posture, children will start to suffer from back pain just like adults do. So ensuring that kids have got good technique, not just training anterior muscles, but training back muscles as well and keeping strong all over is usually important. Sever's disease occurs at the heels. It's a growth condition in where the Achilles attaches into your heel bone, the calcaneus. We get rapid growth from those areas. It starts to stretch and it can become tight. And if we do too much impact, as in jumping, bounding, running, it starts to inflame and become quite painful. That might be something that through a growth spurt will occur quite regular, and you will have to adjust training. If they're doing like sprint training or jump training or anything like that and they're getting pain, we need to ease off it. We need to look at mobility, flexibility, those sort of things, making sure we deal with the issue and then maybe try back a few weeks later. Osgood-Schlatter is a condition that occurs at the knee. And again, where I talked about the femur and the tibia growing from those ends very rapidly, it can stretch a lot of the connective tissue and cause micro tears. Quite a significant number of children get Osgood-Schlatters. It's one of the more common growth conditions. You get like a hard lump over where your kneecap is, just underneath the knee, and it becomes very painful and sore. If you kneel on it or anything like that, it will be a very uncomfortable position to be in. So we have to manage that as best we can. Again, impact activities, lots of kicking. So if they're a footballer, it's going to be difficult for them, but we need to adjust the intensity and frequency of what they do, and maybe look at other things that can help to strengthen that area and ease it off. But I had Osgood-Schlatters, and I remember the doctor just saying to me, you need to stop sport for 2 years. Luckily, we know more than that now, and I didn't. I just went through the pain, and it was uncomfortable. But we know now that non-impact swimming, cycling, those sort of things can help to strengthen and maintain. But ultimately, you will have to reduce off some of these activities that are causing pain or deal with the inflammation. So ultimately for this, the structure and content of your class will vary according to the age range of your group. You can't just cut and paste the same sessions with different age groups, because if we're going into any growth conditions and that sort of age group growth spurts, we're going to have to adjust and look at alternatives. As a good coach, you should have a range of alternative exercises in order to cater for this. So if you're doing like a circuit routine and you might have got, I don't know, star jumps on one of them, and that's impact on knees, we need to have a non-impact alternative so that everybody can take part. It's not labeling saying you can and you can't. It gives them the option. If this is painful, I'm not going to do it. I'm going to do something else. So we have to think logically about how we program well. So growth-related injuries can be minimized and avoided if we have a good understanding of this. And like I said, as coaches who are working regularly with kids, making sure that they're mobile and flexible is probably the best thing that we can do, and probably the most underrated thing. You know, we have limited time for a session. If you're working in a school, you might have got 45 minutes. By the time they've got changed, you don't want to be doing a long warm-up and long cool-down, but you need to be building it into the program that you do so that it's naturally occurring and they get the benefits of that. Other strategies: avoid competition between boys and girls. The size and weight can vary considerably, and that can cause issues. Overtraining, doing the same sport or the same activity too much, can cause problems. At a young age, really, they should just be doing a range of different things. Yes, they can have a favourite. It's quite contentious in that, you know, young kids who get signed up by a football club, they're then told not to do very much else. We know that can limit their development. They can learn things from other sports and other activities that can help them later on. So trying to size match if doing partner work. Self-esteem can be affected due to body shape and size. Some kids that grow quite rapidly tend to stoop over. They don't want to be the biggest kid that stands out. So we can have issues there for their posture and alignment. We've just got to make sure that they're comfortable and promote that sort of thing. Having a regular balanced exercise and not overdoing the high impact is key. And always teaching warm-ups and cool-downs and using appropriate sized equipment is just key, really. Okay. A little bit on the physiology, energy systems. Again, for those that haven't done level 2 gym, apologies if it's going a bit fast, but after the next few days with Laura, you'll be able to come back to this. But your phosphocreatine system, which is your immediate energy system that's used for high intensity exercise, there's limited evidence of any difference between an adult and a child in terms of this system. So they can do very short bursts of high intensity exercise, but then they will need to recover the same as what an adult will. So yes, you can do a little sprint or you can do something energetic for a few seconds. They should be able to cope with that, but then they need to recover. The lactic acid system, which is more your intermediate, it's still quite high, but pre-adolescent children have less muscle and liver glycogen. It does improve as they get older, but what this means is they don't have the fuel for longer, high intensity sort of workouts. They're not equipped to tolerate extended bursts, okay? So that's one thing that we need to be aware of. Aerobic system. Pre-adolescent children use mitochondria within their muscle much more than what adults do. So they're very good at using oxygen as an energy source. They have quite a high anaerobic threshold, so they can work at quite a high intensity and be able to manage that. They reach steady state faster than adults and recover faster than adults do. And they have a naturally higher basal metabolic rate, so they burn energy quicker. Okay, so that's why the aerobic system is geared up to support that. That's why kids can keep going at sort of moderate levels. They're very quite efficient at doing that. So aerobic conclusion, younger children have a more efficient aerobic energy system than adolescent children. They therefore warm up quicker and cool down quicker. So with young children, we don't need to be spending vast amounts of time doing that. 3 to 4 minutes is probably sufficient in order to do a warm up for young kids. But we shouldn't neglect this system. Even though they're adept at it, they need to be using it regular because it builds a foundation for the future. Overall, energy systems guidelines, we should use interval style training for the way that children use their energy systems. Children run around and then they stop and then they'll run around again, and they just seem to be able to keep going like that. If you do it too much and it's enforced on them, you tend to get that mardy behavior where they'll start whining and saying, I don't want to do this. And that's just their way of saying, I'm not coping with the energy system. An adult would just say that's too much and take a breather, but kids will throw a paddy and just sulk and those sort of things. So we can do interval style training, but build in the rest periods. Active rest is a good way to make sure they don't cool down, don't just stop. They can walk around, they can do little skill things, and we'll cover this in the circuits that we do. But really, just to avoid long bursts of anaerobic work is key. Cardiovascular system overall, children have a lower stroke volume, so they can't pump as much blood out of the heart per beat. They have a lower maximum heart rate, cardiac output, so they can't pump as much out overall. But they have higher resting heart rates. Because the heart doesn't pump as much blood, it beats faster. So children have a higher resting heart rate than what adults do. Their blood pressure is a little bit lower. So if ever you test blood pressure, don't panic. If it's not 120/80, it will be less than that. So that's normal. It will increase as they get older. Children have a naturally higher breathing rate than adults. So monitoring breathing capacity is not visually as effective as it is with adults. It's often higher, so we can't use that as a gauge of how hard they're working. VO2 max is lower. They're not able to do maximal activities as well. The conclusion is, although children appear to have an inferior system, this is relative to body weight, and when tested in relation to body weight, children have a more efficient aerobic capacity than adults. A lot of kids can actually just run 5 and 10Ks at a young age. It looks a bit awkward in terms of the technique and stuff, but a lot of kids can just do it, whereas adults would have to train for that. However, due to shorter limbs and less muscle mass, it can be less coordinated and less technique, which can increase their oxygen consumption. Last slide, I think. Body heat regulation is important to look after. Children have an inferior cooling mechanism because they have a lower blood volume and higher skin temperature, so they will burn up quicker than what adults will. This is again related to them then having a breakdown and a paddy and a Mardy session. It could just be overheating. They expend more energy per kilogram than an adult does. So due to their size, they overeat, but they can also cool down quicker. One of the things I see a lot as a coach, I've worked in many schools and done PE conferences and all those sort of things. And when I've gone around schools, the amount of times I see kids in groups of 2 and 3, and the coach goes across and says to the first group, I want you to work on this, and this is what you're doing. And then they go to the next group, and then they go to the next group. Well, kids are just stood doing nothing. They're cooling down rapidly. We've got to be much more fluent with what we do and keep kids engaged. So it's one of the things I'll be looking for as a coaching strategy, is that we're not over explaining everything, and we're getting kids doing and then learning as they're doing it and improving. They also have less body fluid and are at a higher risk of dehydration. So we should make sure that we incorporate drinks breaks regular just to keep them topped up. There we go. How's that for everyone on anatomy and physiology? Blown anybody's brains, or are we all okay? Yeah, good. All right. I know it's a lot to take in. In your manual that comes, you have got a chapter on bones and joints, cardiovascular system, muscles, where you'll be able to reread through all this sort of stuff if it's new to you. And like I said, if you're doing the level 2 with Laura, you're going to go into it in a lot more detail. I'm presuming that these that have come from, is it Qualitas? Yeah. As coaches, I'm sure you've got, a lot of you have got good background in this sort of stuff anyway. So I don't want to teach you to suck eggs, but I think by understanding a children's physiology and what happens at different age groups, it will make you a better coach. You will understand what's going on more with their body. If they've got certain conditions, we know how to adapt it a little bit and just make everything a little bit more inclusive for everyone. Okay. Now, next one I'm going to do, which won't take too long, is just a little overview on resistance training. Most people who come on this are wanting to know things like for circuits, or if they're taking kids in a gym, what they can and can't do, how we coach things and those sort of stuff. So I'm just going to go through some of the basics on resistance training, and then we'll touch on that more when we do the practical. So we should have probably about another 10, 15 minutes, and then we're done for today. So just bear with me. After we've done, if anybody's got any questions, I'm happy to talk about. One of the things I didn't do was tell you sort of who I am. My name's Dave. I should do that now. But I own Envisage. It's my company. I started it in 2003. So I have a background. I have a degree in sport and exercise science, and I have a master's in exercise physiology. I started off in elite sport, and then started doing seminars and lectures, and then really found that I enjoyed presenting and teaching. So I started this company and did this. But my main background is from a number of years has been in children's health and fitness. I was a founder member of the International Youth Conditioning Association, which is the largest children's organisation in the world. And I did most of my training over in the States, going over and working over there with the coaches and seeing what they do. So I've got a reasonable background in this, so I'm happy to chat about stuff if people want to know stuff separately. But this is just a basics, really, in case you're thinking of doing some strength and conditioning with kids. I suppose one of the things we should address is a lot of people are afraid to do strength training with kids, or the fear of hurting them and causing damage. A lot of this came from a piece of research which was done in the 1960s. An American physiologist reported in a physiology paper after his travels in Japan. He went to Japan and he went to some mountainous regions in Japan in the 1960s. And what he found were that the populations where children had got stunted growth. And after observing them for a while, he said that they were doing hard physical labor, which he classed as strength training, doing lots and lots of heavy resistance training, pushing, carrying. And he came to this theory that because of all that sort of stuff, it was stunting growth. It was stopping them from growing because it was too much. That got reported around the world. And ever since that time, there's been a myth of children shouldn't do strength training because it stunts growth. Now, it's been pulled apart, that research, well, not even recent years, quite a while ago, in that any population at altitude, because of low oxygen, tend to be stunted in growth, a smaller stature. Anybody that does 10 to 12 hours of resistance training a day is going to have issues. It's not really resistance training, that's just hard labor. They also had a very poor diet, and there were lots of issues around this sort of research that isn't right. What we know is it's a complete opposite of that. If children engage in strength and conditioning, it actually promotes growth. makes bones stronger, it makes muscles stronger. Now, I'm not talking about turning kids into like mini armies and everybody doing bodybuilding and those sort of things. It's just general strength and conditioning. It can be body weight, it can be including equipment that's age appropriate and those sort of things. But if we do that, we know that children will become stronger overall and grow quicker. So we can answer that for any concerned parents or coaches that are not willing to engage. It's hugely important. We get a lot of myths as well around it causes increased injuries. It's hard for us in this country to answer that, but if we look at America, because of their medical system, anything that goes into a medical facility is reported because of insurance. So what we know is for all the activities that kids do in America, American football, soccer, baseball, gymnastics, ice hockey, all those have much higher injury rates than anything compared to strength and conditioning. I've found from my own experience, apart from like dropping a dumbbell by accident and stubbing a toe or kicking something in a gym area, injuries are very, very low. The main thing with children is supervision. If you leave kids on their own in an S&C facility, guaranteed they're just going to be stacking as much as they can. They want to know what they can lift, and it becomes a competition. I did it when I was younger. When I was 13 and good at gym, that's what we did. Every time the teacher left the room, we all just tried to lift as much as we can. So if we supervise and we have protocols in place, there's actually very, very little risk. I've had parents come to sessions who I've been delivering S&C sessions, and they're concerned that I've got, I don't know, little Johnny lifting a 5 kilogram bar, and they're saying, is that safe? But then after that session, Johnny goes to gymnastics, jumps off a high beam, somersaults and lands, and puts 5 to 6 times his body weight through his spine. And they have no issue with that at all. And it's just understanding the difference. A lot of what kids do in sport can be risk, but by being stronger and developing their bodies, they're much more able to cope with that. And that's the whole point of strength and conditioning, really. So what's the difference? I suppose we're wanting kids to do weight training, is what I think, in terms of looking at technique, looking at higher rep ranges to start with until they've established good technique and the bodies are able to cope with higher loading. So we're avoiding sort of weightlifting, the maximal loads, the low reps, until the body's well accustomed to it. So a lot of technical training to start with children and getting good habits. When I talk about resistance training, I'm not wanting to go against other things, but ultimately, from a healthy point of view and from a weight management point of view, we want kids to be doing a combination. I want them to be doing resistance training and some form of cardiovascular training, ideally not one or the other. If they really don't like something, as long as they're doing something, it's good. But if we can, 2 or 3 times a week, some sort of resistance training, and then challenging the cardiovascular system in other activities that they do. If they're focused and they like going running and doing that sort of stuff, that's great. But if not, team games, individual games, play, anything like that is really good. What we're trying to do really is just have a positive effect on their psychology. So increasing self-esteem, they feel better, they feel stronger, they improve their confidence, social development, working with others. Ultimately, I don't just want to focus on resistance training, we're looking at the bigger picture. Training volume for children. So in the first 2 to 3 years of training, we're just building up their resilience to load. But what we need to do for children is look at increasing frequency of workouts, increasing duration, like the reps or the mileage, or increasing the number of exercises that they do. I want to be working on all those 3 sort of things before I start looking at increasing load and intensity. Like as an adult, you go to the gym, a lot of adults will do a set. Once they can achieve that set, they put more weight on and then they go again. We want to look at the reverse of that for children. We want to build up their resilience. So more workouts, more mileage, more reps, those sort of things, before then we start looking at increasing the weight of what they do. Strength training is for children is a lot dependent on the maturity of their central nervous system. So we've talked about this previously in terms of nerve myelination, their ability to fire motor units and recruit more of the muscle. All that will develop as they grow older. They need to be doing resistance training in order to thicken bone, because it's the pull on the bone that causes that increase, so we know that. In young children, we want to postpone loading of the spine. There's a condition called Scheuermann's disease. It's called wedging. It's where if you put a bar on the back of your neck, because a child's physiology is not as developed, the vertebrae and the bones can actually change shape, and then that will be with them for the rest of their lives. So we can front load, and we can deadlift, and we can do all that sort of stuff. But in terms of putting a bar on the back is something that we don't do until they're well developed. And children respond well to complex training, things that get their brains engaged, doing complex tasks, maybe doing some exercises followed by some jumps and bounds and those sort of things, or agility courses and stuff. So just trying to excite their neuromuscular system, not just doing the standard press-ups, sit-ups, those sort of things. We need to be a little bit more inventive with kids. Functional training is great for children, not just interested in them loading up heavy and doing 3 sets of 6. Strength in movement, bridging the gap between strength training and everyday movement. So using things like core boards, medicine balls, fit balls, hybrids, kettlebells, TRXs, challenge them in lots of different ways so that they're learning all the time and getting used to different things. You can adapt anything to the right sort of intensity and level for a child.
Dave, sorry, can I just ask, do you know when you say...
Oh, can you just turn... I'm just struggling to hear you, Imran. Just speak up a bit more.
1 second. Can you hear me now?
Just about, yeah.
Can you hear me? Sorry, yeah, I had my volume down, yeah. What I was going to say was that, do you know, when we're talking about the age here,
yeah.
For the weights, what... Because...
when can they start?
Yeah, that was, kind of thing, yeah.
Now, it depends on the child. It's about their ability to follow instructions and be safe. Now, for me, what age do kids start swimming?
Also about 6, 7.
Yeah,
you know, like
even earlier. And do we consider a swimming pool to be less or more of a dangerous environment than a gym? Potentially more. They can drown, can't they? Yeah. So you have to be clear that once kids are going in on their own at that sort of 4, 5 age, that they will listen to the instructor, they will do what's been said. I think it's the same for strength and conditioning. If you can trust them to be in an environment and they can follow what the coach says, then we can start the basics of strength and conditioning from about the age of 5. Now, I know people have probably got images now of kids with like a bar doing like overhead squats and stuff like that, and we're not talking about that. We're talking about circuit-based activities, fun activities, relays, assault courses, those sort of stuff that can take place in a sports hall or a gym environment. But I've got absolutely no problem with kids starting the basics of like having an unweighted bar and learning technique. It's absolutely fine. In fact, it's perfect, because they will hit points in their growth and potential that if they're not doing it, they miss. So they'll get much stronger, much better. But what you don't want is a 5-year-old in there who's just not listening and throwing weights around and is a danger. So it's an individual thing, but I think from the age of about 5, you can be making a decision on that. Yeah. Examples, starting off with higher rep ranges and then gradually coming down. If they're lifting over 8 reps, I don't think there's sufficient intensity on there unless they're doing lots of it that's going to cause any problem to growth plates or anything like that. 1 to 3 sets is absolutely fine. A very gradual progression. We're not looking at every 2 weeks increasing load and changing it, just having that variety in there. 6 to 10 exercises would be sufficient to cover the whole body, but I would start with less. Start with maybe 2 or 3 compound exercises and then build up from there if they're doing a session. We don't have to mess about with tempo training. You know, there's lots of stuff out there about tempo, as in like, you know, slow, eccentric, fast concentric, all that sort of stuff. We don't. We want just control. So 2 seconds, 2 seconds, in and out with control is ideal. Supervision, we've talked about, there's no excuse. You are liable. If you leave the room and something happens, that's on you. It's a basic principle of coaching. Safety, looking at heat intolerances, looking at how we structure sessions, hydration strategies, all those sort of things have to be built into your session. And that depends on how long you're doing, how many kids you've got, what sort of activities you're doing, but it does need to be planned for. Some of these may be familiar, some of them not. I'll briefly go through them. Those of you who are on your level 2 course will be covering these in the next week or so. Circuit training. Circuit training is just a number of stations that can be done in different ways. And you can do it timed, you can do it for reps or anything like that. It's a nice way to get kids involved. We're going to cover this on the practical. We tend to do things like, we'll do like a strength station, then we'll do a CV station, and then we'll do a skill-based station. And then you repeat it that way for kids who are new to it. Because what that does is you can work your way around and cover most of the major muscles for strength. You can intersperse that with little bits of CV, but not so they're consistently getting tired, they get a break. And then when they do a skill session, they're going to work on some of those other things like balance, coordination, reaction time, but it's almost like an active recovery session. So we build it in that way so that kids don't get overtired. But it's nice, the skill stuff, because that's the game and the challenge, and it keeps them engaged. But again, circuits for kids, for me, I won't be showing you like burpees, press up, mountain climbers, your traditional adult circuits that are just there to beast people. It will be much more varied and engaging. So we'll look at that. A basic multi-set system is just like, one set of 10 and just doing if they're in a gym, they could do like a cable exercise and then go on to do something else and do a set of 10. And then you can do multiple sets of that as they become more resilient. DeLorme is a very old method, but I like it with kids. It's actually called DeLorme and Watkins. It's a 1950s method. It's around that time that, the bodybuilding methods were out there and stuff, your sort of burger systems and stuff like that. But DeLorme and Watkins was a physio in the Navy, and he used this as rehabilitation. And I found it to be one of the most effective for kids when they're learning. So what you do is it's based on a 10 rep max, and a 10 rep max is the maximum weight that you can lift for 10 reps. So if we establish that for a child and we know it's safe, so let's say, for example, they're going to do like a leg press. We work out that they can do 40 kilograms for 10 reps as an estimate, and that's their maximum. So with a DeLorme system, your first set is at 50% of that. So if we said it was 40 kilograms, kg, this would be at 20 kilograms. So what they do is one set of 10 at half their capacity. So it's almost like a bit of a warm-up, and it gets them into it. We often work them in pairs, and they get 90 seconds rest. So as they get off, their partner can then get on. It encourages a rest period. And then on set 2, they do 75%. So that'll be 30 kilograms. It starts to fire type 1, type 2A muscle fibers and switching them on a little bit more. And then they get the 90 seconds rest. And then in set 3, they then do 100%, or they have a go at it. And they try and do 10 reps. Now, they've had a little bit of pre-fatigue, so they might not get there. They just do it with good form. Once they're able to do the 3 sets and do that, we might then say, right, we're going to put your maximum now up to 40.2.5 later, a few weeks down the line, and it'll just adjust it a little bit. Now, it's a nice, safe method to use, and good for partner work. Now, teachers love it from a functional sort of point of view, because I'll put Johnny on the spot because he's the only person I can see on the screen. But if I were to say to Johnny, what's 75% at 42.5? Yeah, that's it.
Yeah. About 32.
Yeah.
But yeah, whilst you've been talking, Dave, I was thinking this, that teachers would love it, being able to embed maths into the lessons.
That's it. Because what they have to do is work out sums, and they start working on percentages, and then that just embeds functional maths into training. So you can get them to design a program card, you can work out your max, and then you can start working 50, 75% out. Brilliant. It ticks all the boxes from a teacher off-steady point of view, but it's a great session to do with kids as well. Okay, so that's DeLorme. Supersets, trisets, and giant sets you will cover on your gym course. But your traditional superset is 2 exercises for 1 muscle. So it's overload. And a triset is 3 exercises for 1 muscle, and a giant set is 4. Now, we're not looking at bodybuilding and overload. There is another method of supersetting, and that's what we call agonist, antagonist, okay? So what you would do is you do an exercise for chest, and that would be immediately followed by an exercise for your traps. So you do the opposite. You get a little rest, and you might do an exercise for your quad, and then something for your hamstring. Then you'll do lats, then you'll do deltoid. And what it does is it trains the children balance in training, that when they do one side of a muscle, they do the opposite side. Now, this is good as well because they learn muscle groups, they learn how to program so that it's a balanced approach, and it works really well. Trisets and giant sets, we just reduce the intensity down. It's a way of like complexity of it. So I don't know, for legs, we might do something like step ups, and then we could do some walking lunges, and then we might do a few squats or something like that. So different sort of exercises, all for legs, but when we do it with adults, we do it to cause overload and pain. For children, we're more just looking at variety of exercises and learning different techniques. So they're good methods. A pyramid is where we start with a low weight and high reps. So they might start with, let's say they start with 15 reps at a particular weight. They do that, and then afterwards, the weight goes up a little bit, so therefore the reps then come down. Now we're only looking at small changes, just a change, and then again, the weight can go up, so then the reps go down, and they do a little bit less. As long as they're sticking between that, not really less than 8 reps, and anywhere up to 20, then it gives them different ability to use different muscle fibers and work in different ways across a range of exercises. Fartlek, interval, and continuous are types of CV training. Continuous, you've got to have a certain mindset for that, just to go and run for 5K. A lot of adults struggle with that sort of stuff, so children will be exactly the same. They'll find it boring and not want to do it. If they do want to do it, brilliant, utilize that. But if not, we might have to work on interval or fartlek training. Fartlek training is just playing around with different speeds and inclines and things, so changing intensity, sometimes walking, sometimes jogging, little sprint, up a hill, down a hill. Really, depending on how they feel, they adjust it. And interval training is a period at a certain intensity, and then they have a rest period at a lower intensity. So if they don't like that continuous at an intensity, they can have little breaks in there and make it work a little bit better. I've just covered a few there, but within those, you've got millions of exercises that you can do, and really you should never run out. It's very slow, the progression. It builds up over time, but that's what I found works really well with the kids that I do. And there we go. Session's done. How was that for everyone? Okay, makes sense? Yeah. Now again, this is just information.
Yeah, I enjoyed that.
Oh, good, good.
I enjoyed that. Yeah, because I've got goddaughters and nieces, and it's just really interesting because as much as we learn this stuff as we're going along, you forget, don't you, when it's your own family, and you think, oh, come on, you can walk up Ben Nevis, and they're getting tired and thirsty, and
yeah. But yeah, and when they have the little paddies and stuff, you understand it now.
Tantrums, yeah,
absolutely. But like I said, all this will be reinforced when we do practical, and we'll show you different ideas. I'm looking forward because I know that a lot of you work in coaching with kids, and that's what's great on the course, because you'll all have little ideas yourself. And what's great is everybody shares, and what I want you to do is just write down and take away as many new ideas. Some of you are good and you're going to be good coaches with kids, but you can always learn something new, and I do on courses. I'll be nicking ideas from you, absolutely, because if it works, use it. But yeah, that's it. Next week, we will be looking at how to deal with behavior and motivation and barriers to learning a little bit. So we'll cover some of those sort of things, and then a little bit on session planning, how you put basic sessions together for kids. And I'll build that mainly around circuit training and stuff, and what I would do. But apart from that, can anybody let me know by Tuesday if you don't receive your materials? I think I posted a set to Wales. Is one of you in Wales? Yeah. Has it come?
Yeah, I got it yesterday.
Yeah. Good. Yeah, I thought Laura winding me up when she said post to Wales. I'm like, how's he going to do course? But yeah, that's all right then.
Yeah, it's not family. Yeah.
Good. And like I said, the questions that are in the book, in the learner assessment record, page 14 to 17, to be on the slides that I sent through, do what you can. And ultimately, by the time we get to practical, I want you to just have as much done as possible so that we can spend a day having fun and training and playing around rather than answering questions. I'd rather get all that done beforehand while we're on lockdown. I'm around for a little bit if anybody wants to stay on and ask any questions. Otherwise, I'll get all emails done, and by Monday latest, I'll send you out the slides and email instructions, and I'll send you out a Zoom invite before Friday next week for next Saturday, 10 till 11:30 again. Is that okay? Yeah. Well, enjoy your weekend, and stay on if you want anything. Otherwise, off you go.
Hi, Dave. Thank you.
All right, you're welcome.
Hi, I'm not Craig, I'm Jules.
I did look. And
I have wrote it in the thing. Yeah, I didn't realise I've got my husband.
What name again? Sorry.
Julia.
Julia, right. Julia, not Craig. I did see a message pop up. I've just not looked at it yet.
We've got to be inclusive these days, so we have to be very careful.
Yeah. Well put. Yeah.
So in terms of sort of from now till next week, sorry, are we sort of continuing to starting on the questions, did you say? On questions, what, 14 to 17?
Yes, yeah.
Yeah.
Just do what you can. Use the book, do a little bit of a search, but don't stress about any that you can't do. I might be answering some of those next week that you can't find. And then after that, then I'm available for like follow-up sessions. If we need to have a quick half an hour Zoom to answer any questions, we'll get all that done before we come for his practical.
Lovely. Thank you so much. Really enjoyed this afternoon, this morning. Right, thank you.
You're welcome.
See you next week.
Bye.
Thank you. Bye. Bye.
Dave, what we're going to say that, you know, some of this, it's possibly not, sorry, can you hear me now?
I can hear you.
Yeah, so what I was going to say was, yeah, this youth, you know, the young people, in terms of, you said that was your background. I didn't know that, Dave. I didn't know that was.
Oh, yeah.
Yeah, because, but I'm working with Dave at the moment, you know, with Dave Hembra and stuff.
Yeah.
So we've done some weight training and stuff. But this, what you're saying, even going lower, with lockdown right now, we've got like a 7-minute program. We're doing 3-4 times a week. That's more aerobic, some resistance involved. But I think these guys are willing to use, you know, because equipment's quite interesting, isn't it? All the kettlebells. So if there's any further info, Dave, that you can send me, that I'll appreciate anything, you know, in setting programs. Not just the basic, but I'm saying if there's anything else I can read on, I really appreciate it.
I've got tons of stuff. When I come on the course, I'll bring all my stuff from when I did the International Youth Conditioning qualifications. And like I say, I used to go over to America once a year for a number of years and work with the mentors and teams over there. I'll bring in everything because I don't use it much now. I'm happy to borrow you some stuff for a while, and you can take what I've got, have a look through, and just as long as I get it back at some stage, because I offer it people on every course. But I've got quite a lot of stuff you can have a look at. No worries.
Yeah, no problem. And we could get our own results. The second one is, do you know what you said about? So I've done my gym not long ago, and I did that strength conditioning.
Yeah.
I don't need to do no exams or anything now.
Don't worry, Imran. No theory exams for you. You're safe. Yeah.
I'll enjoy that. That's it. I'm going off now, Jim. I'm going to enjoy the rest of the weekend then.
Okay then.
See you guys later.
Top man. Thanks.
All right. See you later.
Bye. Who's next?
Sorry, I just wanted to sort of like introduce myself a bit as well to you. But I work at Qualitas, so I look after like the Chesterfield area.
Yep.
And obviously a lot of information you've been speaking about is really interesting and relatable to what we see. But a lot of our staff that have obviously linked with Laura, ready to do the gym instructing, it's going to be really helpful.
Yeah.
I think for us, from my point of view, and dealing with head teachers and PE coordinators, that myth busting is like a huge barrier.
Yeah.
For what we do in schools. And I think something I want to try and do on the back of, obviously now we've started doing these programs, is try and set up a bit of a 6-week program, and potentially, I don't know, longer term, some link with whether it's some CPD with PE coordinators and head teachers in the long term, just to try and, like I say, just bust some of them myths. So they're probably a bit more active and proactive in delivering some resistance training and trying to get the kids doing things like that, because we've definitely seen them issues.
I can help you put some stuff together from a research point of view. That they, they're educated people, aren't they? That if you give them something, they can read it through and they can understand it themselves. If you want to put some sessions on, although I'm coming to, we can do practicals as a group and peers, but if you want to set up one or two where I come into a school, then I'm also quite happy to come in and say, look, we've got somebody who deals in this. They're going to come and monitor it and check. I'm happy to speak to a head teacher. I've answered all the questions over the last 20 years from head teachers. And like I said, teaching at PE conferences and stuff, I've had the same from even from PE teachers who are just like, no, we can't do this. We're not allowed. But times have changed. And I think if they know that it's good for kids, it's safe, and it's actually going to benefit them, why wouldn't they want to do it? I think most would be up for it. So I think, like you said, a six-week program, after school club, lunchtime club. Let's start looking at some strength and conditioning. Maybe label it something else. Maybe when you see that strength, people are like, oh God. So maybe just put a conditioning course, take away some of those barriers and myths, and then just get on with it. The kids, I find the kids love it. When kids are using things like battle ropes and TRXs, they're just like, wow, never had this sort of stuff. And
I can imagine.
They really get into it. So and a lot of it is, from a school point of view, is not huge investment. Maybe for about 200, 250 £250, you can get a range of kit that they'll have not used before. It's quite hard wearing, isn't it? You can't really break it.
I was going to say, I bet it lasts a long time.
So great stuff to do. Happy to work with you on that. Come back to me. We'll do the session, and then afterwards, whatever I can do, I'm more than happy to help.
Cool, perfect.
Okay.
All right, but thanks for that, Dave. It was really good.
No worries. I'll go for
see you next week.
George next.
Oh, I just wanted to say thank you. And
you're welcome. No, glad you enjoyed it. Yeah, I will see you next week.
See you.
Mike.
Yeah, I'm just kind of listening to what people have to say in case I'm saying anything extra, to be honest.
You've got this background anyway, haven't you?
Yeah, through my SSC degree and my master's.
Does it fit in with what you've done and stuff? Makes sense and aligned with what you think?
It does, but there was still extra stuff on top of that, so that was pretty good.
Good.
I enjoyed it.
Yeah, it'd be good getting on practical. I'll get you acting like a 5-year-old and see how you like that.
Yeah, looking forward to it.
Good. All right then. Take care.
Thank you. Bye.
Thank you again, Dave.
All right.
I'll see you later. Dave, I'm interested with yourself. Once this is over, we're designing something for Burngreave. So I'm interested in, having a youth project set up as fitness for young people. We've got people who are delivering, but they're not, like you just said, like PE teachers and stuff, they're not really up to date with the science and stuff. But it'd be a really good project. We've got like the Move More in Sheffield. And they're pumping money in. But I don't really think they have like a long-term strategy, Dave. We could link one up with yourself. Where I'm going to propose to Move More. I'm meeting with them on Monday. Just come at a good time. And I'm going to propose that I'm working with yourself. And what we want to do is have level 2 qualified, young people fitness coaches.
Absolutely.
And we can look at that, how we can put a budget on. It could be specific for Burngreave, or it could be put on for the whole of City. We can work a price out with yourself. I'm saying, look, that's our long term. I'm working with Dave. We're doing our qualification. But rather than me just having it, I'd love to have 10 coaches, Dave, who can embed this learning. But the problem we're having is when you do this learning, people are not really going back and implementing it. They've just got that certificate and off you go. Do you know what I'm coming from? But I think in the coming 2-3 years, it'll be really good, especially after lockdown. But I'm going to propose that to him, Dave, and I said, look, we're probably going to sit down and have a discussion of how we can get to where we can
I'm more than happy to work with you, Imran. It's always been good. So anything that we can do to work with you and support, and anything that has an impact for kids in the community is always good for me. I mean, you're involved with Dave Ember as well. You've got another genius there that can offer advice, and he's sometimes finds little pots of funding, doesn't he, and can help and is well connected. So use all that and let's make a difference.
But what we've got, Dave, is I've just set my own organisation up. It's called, Silent Youth Project. So it's a youth project. We can download funding and everything now. But one of our focus is going to be around health of young people.
Yeah.
And us coming from a diverse background, mainly predominantly Pakistani young people.
Yeah.
I think, do you know what? We can have a strand for the next 5-7 years. Do you know, like the Sport
Yeah.
England have just released a 10-year one. And we can get more youth coaches and young people from that background. And others are welcome.
Yeah.
But, when we have like a focused project. But what I'll do is I'm going to propose to them that that's the direction we're going in. To have a burn grief training hub. A part of that will work with yourself, Dave.
Yeah, and like I said, one thing is training people up, but then once we can get back into doing sessions as part of that, if I can come along and maybe lead a session for your coaches with some young kids, and periodically come in and say, look, you could try it this way, we could do this, and just keep their learning going on, then that'd be great as well. Yeah. And
even if you just watch us deliver, Dave, like I'm delivering right now, you'll see where I'm coming from.
Yeah.
But yeah, we can because I've got that building on Peter Street, Sheffield Indoor Cricket Centre. Yeah. And we've got like one half of it, Dave. I showed Jordan this building. It's massive. Dave's seen it and all. But they're not doing with it, Dave.
Yeah.
It's a cricket centre. So I'm breaking it all down and making a new up-to-date gym inside as part of it.
Mm-hmm.
But I'll get your input, Dave. I'm going to put it down anyway and let's see where that goes to.
Good. Well, I'm going to let you go and change that nappy now. You can go and change some nappies. And I'll see you later.
No problem, mate. See you later. Look after.
All right. Take care, everyone. Bye.
All right. See you later. Thanks, Dave.